Uganda's health system was ranked one of the best in the region by the Year of Independence from British rule in 1962 and through the 1960s. The population has since grown from 20 million in the 90s to 42 million today. With a population growth rate of 3.03%, there is increasing pressure on the healthcare system to deliver health to the people of Uganda. Her neighboring countries struggle with conflict, which has led to social instability, population displacement, and an influx of refugees. Over the last couple of years, the country has also been prone to natural hazards, including disease epidemics, drought, flooding, and persistent landslides that have led to displacement of people, stretching health and social services in the host communities. The main challenge of the health system is the lack of resources to recruit, deploy, and retain human resources for health, particularly in remote localities. The health system suffers from lack of skilled healthcare workers at the health facilities, lack of equipment, delayed arrival at health facilities, and poor functioning of referral systems.
In Africa today, people are unable to live long enough to even have an African dream. And those who live long enough are not even able to live long to see their dream become a reality. And this is due to preventable and treatable illnesses. Over the last 8 years, Jungle Medical Mission has been working hard to address these challenges through 5 focus areas. First of all, we do general medical camps. The doctor-patient ratio in Uganda today is about 1 doctor for every 20,000 patients. So when we do our medical camps, we move around the country. We go to various villages and we set up a makeshift clinic wherever we find space. We have 1 dentist for every 144,000 patients in Uganda. And these dentists, by the way, are in urban areas, which urban areas represent about 25% of the country. So that means 75% of the population is rural and they have no access to a dentist. Through our dental camps, we do dental extractions and treat dental caries. That means we're able to relieve someone's pain instantly, but then also to make sure the dental caries do not complicate into more serious issues. Currently, we have about 57 patients receiving cataract surgeries from Mengo Hospital. We have reproductive health clinics. And when girls are getting pregnant young, it means we are going to have bad outcomes of labor, because many times they have an inadequate pelvis, so they get into obstructed labor, we get fistulas, and we get maternal and infant deaths. So addressing that issue helps to cut the vicious cycle, making sure we are not having more mothers and infants die during pregnancy because girls were getting pregnant young. Today we have about 8,000 mothers dying every year due to pregnancy-related issues. But through our maternal and child health program, we sponsor vulnerable mothers to get free antenatal care, free intrapartum care, free postpartum care. That means we are helping to reduce the maternal mortality rate. Because most of our work is outreach work, we move all over the country. But sometimes we have critical patients that need more specialized care that we are not able to address out there in the villages. It has become necessary for us to build our own static health facility. It means that we shall be able to refer our critical patients that we find in the villages straight to our healthcare facility. We are going to have a maternity ward, so it means that our mothers will be able to come and labor and deliver in a quality controlled area. Also, we are going to have an outpatient department to mean people can walk in, get treated, and then go back to their homes. This facility is going to help the vulnerable people to get free health care. Someone might ask, how will you be able to sustain free health care? We are going to also have a private wing on the facility where the VIPs and the middle class can come and pay for the service they receive. Just in the last 4 years, we have treated over 20,000 patients in the entire country. Now, with the level of trust that we have from people in the communities, once we are present continuously through a static health facility, we shall be able to catch some conditions even before they complicate to kill our people. Today, we have partnerships with different medical teams that come from all over the world to work with our local team. It's important for us to have knowledge and skills impartation amongst our own local staff. So we are going to be partnering with doctors from all over the world to come and use our facility as a training center. Ladies and gentlemen, I appeal to you not just as the founder of Jungle Medical Missions, but on behalf of all the vulnerable people in Uganda. With your financial contribution of any amount, we shall be able to get the hospital built. We already have the land for the facility, we already have the architectural designs, and we are just waiting for a hand up, for a financial contribution to be able to start building this hospital. And this hospital will not just be a hospital, but a safe haven for the vulnerable people in my country. Thank you very much.
Jungle Medical Missions, restoring health, rebuilding dreams.